Job today is for Hoffa's fat pad syndrome or irritation of the infrapatellar fat pad. What that means is right below the kneecap, you have various sensitive structures, one of which is called the infrapatellar fat pad. So it's like a fat pad that helps cushion the knee, and it's right under the patellar tendon. Sometimes when the knee goes into end range extension like this, the kneecap doesn't lift out of the way properly, and then it can pinch this fat pad between the kneecap and the femur or the tibia, and it can be like pretty extreme pain when that happens. Okay, so the first thing that I like to do is to have a roll under the knee or something to elevate the knee so that there's about this much angle, about 30 degrees. That way you're taping the knee in a position that's going to cause, where it's going to start to create some level of irritation. Okay, so the first thing that I like to do as well is check to see where the kneecap is, because this is going to be the thing that I'm going to try to manipulate. So I take my hands and I identify the kneecap by just finding the boundaries like this, and then what I'll do is I'll mark the very outside of either side, and then also right at the very bottom here. This helps me identify where the midline of the kneecap is, which is going to be very important, because what I'm trying to do is to tilt the kneecap up away from the sensitive structures. To do that, when I apply the tape, it's going to have to be above the midline. So the first tape that I'm going to apply is called HypoFix, and the reason they call it this is it's more of a hypoallergenic tape. It doesn't cause as much irritation as the second tape I'm going to put on, which is the Leukotape, and the one that's actually going to create the effect. So all I'm really doing once I have these dots here is I'm going to follow kind of them. So I start at here where the first dot at the tibial tuberosity is, or the bump of your shin, the top part of your shin, and then I just basically measure it along the side of the kneecap like that until about a few centimeters above the kneecap. Okay. Now this stuff doesn't have to be laid down in any particular fashion other than in where the brown tape is going to be lying. All it is just a protection to the skin. So there's 3 strips to this tape job. So the first 2 are just going along the sides of the kneecap, from the tibial tuberosity, as I said, to a few centimeters above the kneecap on either side. Okay, so now this is the first bit of tape that's going to be doing that tilt component here. So remember, we have to identify where the boundaries are. There's the center, so when I'm applying it, I'm going to apply it definitely not directly on the center, because that's just going to push the kneecap into the femur, so above. And I usually go down to about almost the very sides of the knee. And you can almost see it even with this tape, it kind of bulge up at the bottom. The inferior pole pulls a little bit anteriorly from that to the end of the femur. All right, and now this is going to Leukotape, and this is what's going to be applied on. And you're basically following the same pattern here. But what you're going to do is I want you to put a little bit of the brown tape just slightly on the skin, just a bit on the skin, so that it adheres a little better. Otherwise, it tends to fall off. The Leukotape hair can sometimes be stubborn to tearing, so sometimes you'll have to use scissors. Now this one here is going to be the effective component that's going to be tilting that kneecap away from the tibia and the femur. So I like to measure it out first, and just slightly off the skin there. And then I'll tear it and then reapply it so I can apply the right force in the right direction. Okay. So it's literally like you're trying to tilt it here, so you have to visualize that. There's the center, that's there, and then so you're going to be applying it, pushing it down like you're tilting that kneecap up. Just like that. And then once the tape's on, you can try it out, make sure that it's good. If it feels like it's painful, maybe you had the tape a bit too low and it's pushing the kneecap into the sensitive structures. Otherwise, you can keep this tape on for about 3 days. And then after that, when you take it off, just take note if you notice any irritation, and then just go from there. But don't leave it on for longer than 3 days.